Good afternoon, teachers and parents. My name is Ashala Hayward, and I'm gonna show you in a life of a typical child. A typical child is a child with disorders or disabilities. Now, I'm gonna speak to you about autism spectrum disorder. You may ask, what is autism spectrum disorder? Autism spectrum disorder, or ASD, is a growth disorder which is crucially collective, connection, and intellectual problems. Infants with ASD does not look different from others their age, but the way they behave, communicate, interact, and learn is different from others in most ways. ASD can be formed from being special to critically disabled when it comes to learning, thinking, problem-solving skills, according to CDC Research 2020, which means that children with ASD might have problems solving puzzles, playing board games, and are slow in learning. You may ask, what are some of the signs and symptoms of ASD? According to CDC research, infants with ASD may not point at objects to show interest, for example, points at shape on charts. So I may call on John to show me a square or circle, but because John is not interested, he will not do it. Always want to be alone and does not make eye contact. So a child with ASD or a child without ASD may go and play with a child with ASD, but because a child with ASD does not want to play, he will leave and go alone and sit in a corner. Does not know how to play pretend games, for example, pretend to drive a car or play with feed a doll baby. Causes of ASD. According to CDC Research 2020, scientists concur that heredity is one of the traits of ASD, which means a child can inherit ASD from their great-grandmother, great-great-grandmother, or their great-great-great-great-grandmother. Evidence that critically times for developing ASD happens before, during, and immediately after birth. Infants born to elderly parents are at large risk for having ASD, which means that children born to parents over the age of 50, because of their parents' age, this can cause ASD. The prevalence of ASD in the United States, St. Vincent and the Grenadines, doesn't have any. According to 2016 data, the CDC report that approximately 1 in 54 children in the US is diagnosed with Autism Spectrum Disorder, ASD. 1 in 34 boys recognized with ASD and 1 in 144 girls recognized with ASD. Boys are 4 times more likely to be discovered with ASD than girls. Most children were still being diagnosed after the age of 4, though autism can be reliably diagnosed as early as age 2, which means that children can be found with ASD at as early as 2 years, but because children goes to primary school at the age 4, they wait and see if they can hold pencils, interact with others without screaming, crying, or being by themselves. Diagnostics and techniques used in USA, since SVG does not have any diagnosis. According to CDC report 2020, monitoring, screening, evaluating, and diagnosing children with ASD as early as possible is important to make sure children receive and assist and approval that they need to reach their full potential, which means that finding out if a child has ASD at an early stage can help them to reach their goals. Developmental monitoring observes how your child grows and changes over time, and whether your child meets the typical developmental turning point in playing, learning, speaking, behaving, and moving, which means that they watch the child to see if the child is fully fluent in speech, plays with other students instead of crying or screaming or going by themselves, how they behave, if they keep still or always on the move. The diagnostics and techniques are used globally in ASD cases. Diagnosis criteria. The diagnosis of ASD keeps changing on a daily basis, and even the terms of subsections of autism-based disorders, which means they do not have any stale or frequent disorders, since the disorders keep changing a lot. Does St. Vincent and the Grenadines follow the same protocol? No, we do not follow the same protocol, since we do not have any form of procedures in place to identify or treat children and teach parents about ASD in my country. In St. Vincent and the Grenadines, children with any disabilities are being sent to preschools by their parents, and then when they are identified by a teacher to have any learning disabilities, the counselors advise the parents to seek further medical advice, and then if suspected by the specialist, they are advised to send them to schools with special needs. Two forms of early intervention used with preschoolers diagnosed with ASD: neuralistic developmental behavioral intervention (NDBI). Intervention procedures respond intentionally and contingently to child's interests, communicative needs, and play. Approval behavior analysis (ABA) and early intensive behavioral interventions (EBI). In contrast to the NDBI's delivery of ABA principles in an operant conditioning program employs a more explicit, discontextualized, and highly structured approach. This method is commonly referred to as EIBI. Specific discrete skills are taught in a prescribed order. Smith, 2011. Long-term early interventions for children diagnosed with ASD. Early intensive behavioral intervention has been found effective in responding growth outcomes for infants with autism spectrum disorder. Children were able to maintain the exploratory gains they made in early intensive in-home intervention over a 2-year follow-up time. For these infants did not exhibit developmental regression or lose skills even after substantial reductions in service. 2 recommendations for parents who have a child with ASD. Set a routine. Parents organize their routine. A child-friendly visual schedule is a great tool for children with autism to have, so that they know what to expect throughout the day and can ease any anxiety caused by transition to the next activity. Continue therapy services at home. Delay mechanized presentation and physical structures can be concerning to parents who may fear that their infants will revert back to a hostile actions. Parents should be sure to get in contact with their child center and other therapists to figure out if telehealth options are available to continue therapies at home. This is the end of my presentation. Hope you enjoy.